complex, and it knocks it out in a matter of 2, 3, 4 weeks. And when we get the IV push and the IV drips, we'll be able to do it even faster. Okay? Infusion therapy, that's the last one that I've been mentioning to you. The nutrition cocktail with hydrochloric acid. You see that. And when we talk about it, folks, we're not going to put enough in there that it should burn and dissolve in blood vessels. We're talking a very, very diluted form. We're talking like a 1 per 100,000 dilution thing. It doesn't take much. But I've read an excerpt from an MD's diary back in 1920. He worked back east. This is before they had antibiotics, and they thought back then that injecting things into the veins was very dangerous, so it wasn't endorsed. And he was called out to see this young woman. I think she was a teenager, probably about 16. She got pregnant, lived down in this real, kind of what they call the hollow bottom country, kind of like an Appalachian type thing. She had a baby. She got a roaring infection from it. It was very dirty where she was living. So he went in there and he thought the girl's going to die. She was going into septic shock. And so he thought, got nothing to lose. He read about this, took the thing, did an IV push with hydrochloric acid on it. Came back the next day, figured she'd be, told the family to get ready to, make arrangements to have the funeral. She won't live till morning. Came back the next day, she was alive. And she was actually coherent. Gave her another one. They go, well, what the heck? Gave her another one. Came back the next day. She was that much further on. I think 3 of them she completely cured. And I read that excerpt, this thing from this guy's diary. He was a stunt. That's what they did. And then, of course, not long after that, they got antibiotics. There's more money in antibiotics because you can patent them. So they shelved the hydrochloric acid. Hydrochloric acid probably cost you about 5 cents a gallon. You can make maybe 100 million doses out of that. It's so diluted. There's no money in it for the drug companies. So they didn't push it. Because you make a lot of money in antibiotics. But we're going to be using that here shortly, so it's a good thing to have. And you don't have to have the dangers of antibiotics, which are working less and less as we go along. So basically that's it. Let me come over here for just a moment and wrap up with this. We talked about how the health problem in general develops. The concept that we use here in our office is not to have this treatment for that condition, though there's some things we will do that with, mostly in terms of pain, maybe to some degree with infection, but most of the time it's got to be custom designed for the person because everybody's different physiologically. The idea is to bring all the body organs and systems into balance. If you do that successfully, the body will heal. The way you usually get ill is because they get out of balance. They're not working right. They can't regulate. They can't take on the challenges. You can't get rid of the waste material. You can't keep the acid-alkaline balance. For whatever reason, it isn't working, and so disease results. So the body will heal itself if you get this thing going like it should. That is not to say there's not a place for emergency kinds of procedures. I'm not anti-drug. I'm not anti-surgery. They're wonderful tools when they're needed. The problem is they're used too much. Now, if you're a doctor and you say, okay, doc, I'm going to give you, let's say you're a carpenter, and you're the biggest carpenter in the country. And they say, okay, I'm going to give you a hammer. That's all you get to do to build your house with. Like they say, you can treat everything like it's a nail. A lot of tools to build a house. There's a lot of different tools to make the body healthy. Drugs and surgery do not make the body healthy, but they can preserve its life from a severe shock or trauma until we get you where we can start building you up again. There is no RDA for any recommended daily allowance for any drug on the face of the planet, but there is for nutrition. So the idea the body gets out of balance, it goes bad enough, you may need the drugs to keep you alive long enough to where we can get you built up again. You may need surgery if you're traumatized. You get run over by a Mack truck, you don't want me to treat you, you need a good shock trauma team to put you back together. Once you get survived, then come in here and we'll rebuild you. But that's we don't do that kind of stuff. That's where my medical colleagues absolutely shine. We have the best emergency medicine in the world here. Had a lot of wars. You learn. And sew things back on with you before you even think you could. Now, we also want to be safe and natural. You don't want the treatment to become as risky or more risky than the disease that you have. There's no point. The number one saying in the Hippocratic Oath, above all, do no harm. If you can't help the patient, at least don't hurt them. And the kind of treatments we use, that's the way it is. We don't hurt anybody. We don't bat 100%. We're getting close, but we don't bat 100% success, but we never hurt anybody. Okay? It's more than a lot of my core medical colleagues can say. Okay? Lastly, how do we do it? We use a system called nutrition response testing. We will also utilize various kinds of laboratory work. There's some electronic things that we use to find out what's going on with your body. Where are the imbalances? Where are the challenges? Where's the weakness? Once we determine that, this system of muscle testing tells me where to start. What's the priority? That's important. If you start off on something else, you won't get well. I've had people come in here with irritable bowel. You think, treat the colon. No. We'll often end up treating the brain. And we get well really quick because there's a tie in there. Or they come in with type 2 diabetes. I don't treat the pancreas. I often treat the liver or the small intestine, and the blood sugar normalizes. And I don't know, I can't tell you that's going to be that way with you, but you're just tell me. The system of testing like the other things we do. And then we use design clinical nutrition, which by that we mean that your program is specific for you. Every one of you here could come in with the same symptoms, and you probably all have different treatment programs, just the way it is. That's why a lot of alternative medicine fails, because they're trying to follow the medical model by saying, well, I have these pills here for this condition. We take these instead of these drugs. Sometimes that works, often it doesn't. You have to know what's causing the problem and then match the supplements and the treatment to the patient's physiology. Otherwise, you will have a high failure rate. And these, these testing systems work that. So that's how we work it, okay? Does anybody have any questions about what's going on, about how to prevent colds and flu, and if you get them, what your options are? Good. I've been successful in that.
I have a question about detox.
Yes.
Could you describe what
we do? There are two major detox systems we like to use here in the office. The one is simpler, less expensive, a little shorter. It's not quite as thorough. We put you on a specific diet, more of a vegan type of diet, and then we give you a cleansing powder that you make smoothies and shakes out of, along with some limited supplementation. This goes for 2 weeks, and it does a pretty good job. The major one we use is called the SP Cleanse program. It's 3 weeks. It's a lot more involved, a bit more, somewhat more expensive, but it's a lot more thorough. And neither one of them are unpleasant. Okay, now there are a lot of different ones out there. I think a lot of the detox things become very complicated because people like to take things that are simple and make them complicated. That makes it seem special and you can charge more money. Okay, but it's not difficult. The big thing is you give your body a rest. You use the kinds of foods that will tend to alkalize you and help to encourage the dumping of toxins. We will use certain supplementations, mostly food concentrates and some homeopathics, maybe some herbals, to enhance that process, but not to go so fast as to make you really miserable. And then you do that, you pull out the poisons out of you. If you have silver fillings in your mouth, if you've had root canals, if you've had certain kinds of things you do, there's hobbies or at work where you're around chemicals. For example, auto mechanics are notorious for dying from cancer because they use solvents and chemicals and gasoline and stuff all day long. Very common out of cancer in that profession. There's other ones too that you can get into. So if you're around that kind of stuff, I had one woman, she says we found she had some problems. She likes to do certain kinds of artwork. She works a lot around paints and solvents, and we figure that's probably where it's coming from. So you need to clear these things out every now and again. Another good general practice, go on a 24-hour water-only fast once a month. Helps to clean you out. Okay? Helps if the body gets to a certain point, and then what it'll do is it'll start to burn up junk and start dumping it out. But you have to get it down to where you're not eating, and it starts to use its reserves. It starts to clear things out of the system. It takes about 24 hours before that happens. That can be tough for some people. It can make them sick. And so we say the water fast is the best way to go. It can be rather harsh for a lot of folks. So we tend to go more with a vegan type of diet, excuse me, and using the supplementation things that we use for a period of 2 to 3 weeks. Do that once or twice a year. Helps get a lot of junk out of your system. Helps to keep it well. And so that's just a good maintenance too that you can get into. So if you're around that kind of stuff, I had one woman, she says we found she had some problems. She likes to do certain kinds of artwork. She works a lot around paints and solvents, and we figure that's probably where it's coming from. So you need to clear these things out every now and again. Another good general practice, go on a 24-hour water-only fast once a month. Helps to clean you out. Okay? Helps if the body gets to a certain point, and then what it'll do is it'll start to burn up junk and start dumping it out. But you have to get it down to where you're not eating, and it starts to use its reserves. It starts to clear things out of the system. It takes about 24 hours before that happens. That can be tough for some people. It can make them sick. And so we say the water fast is the best way to go. It can be rather harsh for a lot of folks. So we tend to go more with a vegan type of diet, excuse me, and using the supplementation things that we use for a period of 2 to 3 weeks. Do that once or twice a year. Helps get a lot of junk out of your system, just to keep it well. And so that's just a good maintenance kind of thing to do. Okay. Any other questions? Good. All right. Now, for those of you who are not already patients, one thing that I like to do is I'm going to give you each a discount card that if you want to come